At Lakeland, literally thousands of stories are being created every day. Some of those stories include struggle, pain, and loss. Others are more about healing, hope, and happiness. As a community-based organization, our mission is to improve the health of our friends and neighbors. We strive to live this mission every day by bringing our hearts to work, by listening with all our hearts, and treating everyone entrusted to our care with love and respect. Here's a story that has touched my heart. I hope it touches yours.
I had a career in public education and the United States Army for a number of years, and then retired about 4 years ago, and kind of went back to my music performing and enjoyed that. But as a result of that, I think through repetitive use of the instrument, we developed some carpal tunnel. So we went through this process with Dr. Ward with the neurological exam, and just to confirm the fact that it was carpal tunnel. And it got to the point where there wasn't any other alternative because the pain had gotten so bad. We hooked up with Dr. Sybesma, very personable, great bedside manner, and along with that, though, he's a great listener, very acute, sharp listening skills.
He was admitted to the outpatient unit and very well cared for. His surgery lasted a short time, and he was back in recovery without realizing he ever had the surgery. Dr. Sybesma said there would be no restrictions, and within a week he was playing his instrument in a concert. And the discharge was very well done, very thorough. You know, any questions were answered. Then they followed up with a phone call to make sure that everything was still okay at home, and so that was well done. In September I had a torn meniscus, and Dr. Sybesma repaired that, and at the time said the arthritis is pretty bad. I was in pain all the time, and if you're monitoring at 0 to 10 for your pain level, it was usually in the 7 to 10 range. So it was a matter of being uncomfortable all summer or getting it done. And I never considered going out of the area because David had had such good results with Dr. Sybesma. We felt we wanted to stay with him. He was confident that he could take care of it, and made me feel that he was the right man to go to, and that the hospital was where we wanted to be. Another thing about staying local that I feel is very important, we're very active in our church, and having the ability of those people to come up and visit and support and bring food to the house and all that, that's important. And if I'd have been out of town, you know, David would have been the only one that would have been there. And so that's important to me. It was also important that he could stay in the room with me overnight. He stayed there 24 hours a day, so that if I needed something, he'd be there to help me. Plus, he saw how they were doing therapy, so he could follow up on that at home. And it's just a good overall experience when you can incorporate all of your support systems in one place.